1. Introduction. The hepatitis A vaccine is an inactivated, killed, viral vaccine used to prevent hepatitis A infection, a contagious liver disease caused by the hepatitis A virus, HAV. The virus spreads mainly through contaminated food and water or close personal contact. 2. Type of vaccine. Inactivated, killed, virus vaccine. Does not contain live virus. Cannot cause hepatitis A disease. 3. Mechanism of action. The vaccine works by stimulating the immune system to produce protective antibodies, anti-HAV IgG. When a vaccinated person is exposed to the virus later, these antibodies neutralize the virus and prevent infection. 4. Indications/uses. The hepatitis A vaccine is used for prevention of hepatitis A infection. Children greater than or equal to 1 year of age. Travelers to endemic areas. Healthcare workers. Food handlers. Patients with chronic liver disease. Men who have sex with men. People using injectable drugs. 5. Dosage and schedule. Standard schedule, inactivated vaccine. First dose, at age 12 months or older. Second dose, booster after 6 to 12 months. Heavy checkmark 2 doses provide long-term protection, 20 to 25 years or more. 6. Route of administration. Intramuscular, IM, injection. Given in deltoid muscle, adults and older children. Anterolateral thigh, infants. 7. Onset and duration of protection. Protective antibodies develop within 2 to 4 weeks. Long-lasting immunity after complete vaccination. 8. Side effects. Most side effects are mild and temporary, including pain, redness, or swelling at injection site. Mild fever. Headache. Fatigue. Loss of appetite. Warning: serious allergic reactions are very rare. 9. Contraindications. The vaccine should not be given in severe allergy to a previous dose. Known hypersensitivity to vaccine components. Use with caution in acute severe illness, vaccination should be delayed. 10. Use in pregnancy and lactation. Considered safe if clearly needed. No known harmful effects during breastfeeding. 11. Common brand names. Havrix. Vacta. Avaxim. Availability may vary by country. 12. Combination vaccine. Hepatitis A plus hepatitis B vaccine. Example, Twinrix. 13. Storage. Store at 2 to 8 degrees Celsius. Do not freeze. Protect from light. 14. Key exam points. Inactivated vaccine. Given in 2 doses. Prevents fecal-oral transmitted hepatitis. Safe and highly effective. Long-term immunity.